All right. Well, again, welcome. We are here today to talk about uterine fibroids. I am Katie Schubert. I'm president and CEO of the Society for Women's Health Research. SWHR is a national nonprofit dedicated to improving women's health through science, policy, and education. And this panel today is part of the work of SWHR's Endometriosis and Fibroids Network, which seeks to engage and educate patients, clinicians, and healthcare decision makers about the burden of these diseases, which significantly impact the lives of women. I'd like to especially thank our sponsors today, AbbVie, Myovant, and Roche, for their support. Their support has really allowed us to be able to host this public panel and engage in a conversation that I think is really important right now. We're also tweeting today, and you can follow along and join in using the hashtag #FocusOnFibroids. Uterine fibroids affects over 26 million women in America alone, and it disproportionately affects Black women, who are 2 to 3 times more likely to have the condition. The goal of today's panel is to have an honest discussion about where we need to go, the research gaps, barriers to clinical care, and how we can improve patient experience and outcomes. We have 5 panelists today who each will speak very briefly about their experiences as patient advocates, researchers, clinicians, and policy experts and advocates. And then we'll open up the discussion for questions and answers, and please feel free to submit those questions via the Q&A field on Zoom. I'm going to go ahead and introduce each of the panelists all at once, and then we will jump right into the panel and then questions and answers. Today we have with us Tania Venable, founder and CEO of the Fibroid Foundation, Tanika Gray Valbrun, journalist and founder of the White Dress Project, Dr. Jessica Shepard, clinician at Baylor University Medical Center and founder of Her Viewpoint, an online women's health forum, Dr. Erica Marsh, professor of reproductive medicine and chief of the Division of Reproductive Endocrinology and Infertility at the University of Michigan Medical School, and Tammy Boyd, chief policy officer and counsel at the Black Women's Health Imperative. And so we thank you all for being here with us today. We're going to start with a brief intro from Tania, one of our wonderful patient advocates, who's going to give us an introduction of the importance of fibroids advocacy. And then we'll hear from the other folks who will each provide perspectives on patient experience, clinical practice, fibroids research, and the world of fibroids policy. So thank you, and over to you, Tania.
I'm here to share with you an introduction to fibroids advocacy, and I guess advocacy, patient advocacy in general. And I always like to start with kind of what got me here, because people always ask that question: how did you transition from a career in a completely different field to one of patient advocacy? And the answer to that question, unfortunately, is suffering. I was simply trying to solve a problem. I was at my second of 4 fibroid surgeries, and I just wondered if there were other women suffering like me. I was really shell-shocked from the pain and the multiple doctor's visits. And then I learned the statistics, that 80% of women of African descent and 70% of all women by age 50 will be diagnosed for fibroids. And when I learned those statistics, it really hit home for me and made me wonder why everyone wasn't talking about uterine fibroids. So I decided to talk with women about it, and I found that women really just kind of relaxed into the conversation. They looked relieved to be able to tell their stories and to have a listening ear to be able to share their experiences. And I learned that there were far too many women who were suffering like me. So the enormity of this issue was what prompted the formation of the Fibroid Foundation, and I'm sure other advocates will say the same. It prompted the start of their organizations as well. We started as a blog, and then the community kind of grew organically from there. And I found that when your heart is in the work, you don't feel like you're working. You're helping people who have suffered like you have, and it becomes very personal. It becomes a mission. And I believe that advocacy fulfills a huge void that existed. Medicine and research is well intended, but if the patient voice is not present, there's a huge wealth of information that is not there. Personal perspectives are meaningful. Patients are experts in their own bodies, in their own experience, and there is so much to be gleaned from that information. Patient education provides empowerment and it results in well-being, and it can help the community at large. And fibroid mobilization, patient mobilization has really been a game changer. We've been able to make meaningful change in the areas of research, designing research studies, actually sitting on registry steering committees for research efforts, legislation, supporting legislation for fibroid research, and education, helping to complement physician and healthcare providers' efforts by providing patient information in terms of the unique pre-op experience, the unique post-op experience, what to expect, to help inform patients and help ease any stress that they might feel. That's our goal, at least. And so moving forward, the patient voice really needs to be recognized and listened to across all aspects of patient care. And that's what we strive for as fibroid patient advocates, because success is found in collaboration. And the conversations that are occurring between physicians and patients had not happened previously. And so advocacy is a tool to be able to expand that conversation. And when that happens, there's a rich dialogue that happens because there's information to be shared from all aspects of fibroid care. And if we're not all in the same room at the same table, then that does not occur. And we have a lot of work to do, but I truly believe in my heart that we're on the right track because there's power and enlightenment in the patient voice. So some key messages that I will leave with you are that the patient as advocate helps resolve any voids that there are in care. It really opens up a conversation and a dialogue. And another message is to collaborate at each stage of care, because the patient voice is needed there as well. And lastly, I encourage you to think in terms of a more productive society where women will no longer suffer and are better equipped to shed light on their personal journeys. And thank you so much for your time today.
Thank you so much, Tania. We're going to turn it over to Tania next.
Hi, everyone. Let me just make sure you can hear me. Okay. Okay, I'm sorry, I was having some technical difficulties. Hi everyone, I'm Tania Valbrun, the founder of the White Dress Project. And we are a patient advocacy organization that is dedicated to raising the awareness of uterine fibroids. And we help those who are managing life with fibroids. I started this organization out of my own personal struggles with fibroids. And I often share those struggles, which are 2 myomectomies, suffering with iron deficiency anemia, struggling with fibroids, and I'm still living with fibroids today, and also struggling with fertility. So as a patient advocacy leader, I understand the story and the importance of the patient's story. I'm an advocate for people. I am constantly encouraging those around me to share their stories. I believe that our stories shape who we are. I believe that society convinces us sometimes that if our stories aren't compelling, that they don't matter. And I wholeheartedly disagree with that, because each of our stories shapes the framework for how we show up in the world, in our relationships and in our careers. At times, especially when we're dealing with reproductive health issues, issues below the belt, issues that many times we have been taught that we should not discuss, it becomes equally important that we do not mask our story, because it will play out in some part of our lives if we don't express what we're going through. I would also argue that the data needs to reflect our stories and our perspective. My years of being a journalist has taught me that our stories are the most important indicator of who we are and who we will be, and it shapes our entire interaction and perspective with the world. So I take that same mindset when I'm thinking about patient advocacy, and knowing that the patient story has to intersect in every part of this, meaning that it has to intersect with clinicians, it has to intersect with stakeholders, it has to intersect with legislators. And it's important too that we recognize the health disparities and the research gaps that go along with reproductive health issues, and specifically fibroids, as we're talking about today. So I encourage everyone, as we have discussed before, the importance of sharing your story and the importance of sharing your story as it intersects with those different parts of our world. And I appreciate forums like Society for Women's Health Research in this forum that they're putting on to give us the opportunity as patient advocates to share our perspective, share the quality of life challenges that we've had due to fibroids, share the mental health components and challenges that we've had to deal with as a result of fibroids, and really use a bullhorn to really elevate this conversation because it's so important. We have done a lot of work to galvanize our community and mobilize our community around not suffering in silence, how they can be their own best health advocate, what are the tools that they need to arm themselves with when they go to the doctor. So we're really, really proud of the community that we have created. We're also proud of the advocacy work that we have done to ensure that legislators and stakeholders understand why funding is needed, why research is needed, why health disparities need to be addressed, why research gaps need to be addressed. So I'm proud of that work, and I'm proud to partner with organizations like SWHR and to have this public forum so that we can include more patients and more stakeholders who are dealing with uterine fibroids. And I would argue that you don't necessarily have to have fibroids to understand what this plight is, and to have empathy and to support those of us who are dealing with it physically. So thank you so much for being here today. Thank you for investing in your own health and wanting to learn, or wanting to learn about the research, wanting to learn what there is being done. And I truly believe that, as I said earlier, your story intersects with so many parts of the world and parts of different industries. So I think it's important that we are all empowered to share our stories. Thank you.
Thank you so much. Next up, we have Dr. Schubert.
How is everybody doing today? I am so excited to be part of this public panel today, as we kind of collectively have done 2 days of some very hard work behind the scenes, and now we are able to put a lot of those efforts forward and share so many different perspectives when we think of fibroids. So I am a gynecologist and I practice here out of Dallas, and I've practiced for over 10 years. But in those 10 years, what I've really realized is when we think specifically of fibroids, which are again the most common benign tumor of the pelvis, is that how they impact women. Many times as a healthcare professional or a medical doctor, we really do focus on the disease, the condition, and know that pathology really well. But what I've learned from my patients is that how can I impact patients best is through relationship. And those are the relationships that I've built over the last 10 years. And for my women who do suffer from fibroids, is that one, yes, I have an advantage as a medical doctor to provide exceptional care to patients with medical and surgical options. But as you've heard today from our patient advocates, Tania and Tania, that there are so many symptoms of fibroids that can affect women, but it's not always just the physical features of those symptoms, which can include heavy bleeding, pain in your pelvis and your lower back, pain during sex, significant cramping during your menses, and even infecting things like your bladder and your bowel. So it's not so much those physical features, which those are very important, but the emotional aspect of what this takes on for women and the years that they suffer through whatever their symptom is or how it affects their life or their career. So in those moments when I'm sitting with women and I hear of what they're going through and what their symptoms are, is I have the ability to help them with medical and surgical options, but I also want them to know that they're being heard and that we are listening to what they're saying and we are working with them hand in hand to get them that quality of life that they're looking for. And the other part that you'll hear about from Dr. Marsh a little bit later is the research aspect of it. There's so much more in this field of fibroids that we need to learn, that we hope to learn, that we're pushing to learn. And that's really an important part of this process as well, because in order for us in the medical field to make the best next steps in management and treatments and therapies, we really need to understand the basis of the disease. And quite often when it's looked at from a research perspective, sometimes because it's a woman's disease, and if you look at the incidence of fibroids, which typically will affect more African American women, when you combine those, sometimes those are the things that detract it from being the thing that's going to be the most researched. So I hope today that we can get so many questions answered for those that are watching. And thank you so much, as Tania said earlier, for investing in your health and investing in your wellness, because that's so important, that you can get out of this all different. You can see we cover a variety of different topics that you can learn, that you can share this information with others, that I can be of some help to some of the questions that you have today. So thank you again for this invitation today from the Society of Women's Health Research, that we can impact your lives and we can learn more today.
Thank you so much, Dr. Schubert. Dr. Marsh.
Hi, thank you so much, Katie, and thank you to the Society for Women's Health Research for hosting this important event. It's truly an honor to be a part of this panel of esteemed guests, of advocates, of clinicians, of researchers, of women with whom I have collaborated and worked and talked fibroids with for years. I'm going to, as Dr. Schubert shared, I'm going to talk about the research perspective with regard to fibroids. I'm a clinician. I see patients, and I run the clinical division of reproductive endocrinology and infertility at the University of Michigan that's mentioned, but I spend a good amount of my time studying fibroids, trying to understand the biology of these tumors, but also trying to understand how they impact patients and understand what populations of women develop fibroids and why that's different across different groups of women. So really trying to understand 360 degrees, the full circle of how fibroids impact us. Why is research important? Why should you participate in research or consider participating in research if you have the opportunity? Well, research helps inform care. It helps inform how those of us who are clinicians treat patients, what treatments we offer, what treatments are effective versus the treatments that are not effective. But research also informs you as a patient. It helps you understand those same questions, the answers to those same questions, which are, which research are effective in a patient like me? What what treatments are effective, what treatments might be less effective in a patient like me. Different surgeries, different medical treatments, different radiological treatments have different response rates. And what research does is it helps us understand and pair the right treatment for the right patient at the right time. And really, it allows us to practice in a way that is ideal, which is in a patient-centered way. One, I think it's important to also share that research should be and really has to be informed by the patient voice. Some of the work that I've done that's honestly most cited and most discussed is the qualitative work I did from talking to patients who were suffering from fibroids. And one of the first pieces that we published from that cohort of interviews with patients was called Beyond the Physical, which really talked about the emotional and mental health concerns that patients with fibroids have. Learning that almost 100% of the women that we talked to felt impacted mentally and emotionally by fibroids. Learning that most of the women had an altered body image, and it impacted the way they saw themselves sexually and the way they felt sexually. Understanding that their mood was affected, both from the perspectives of anxiety and depression. These are things that when we talk about treating fibroids and treating the whole patient, they're issues that are important to know. We also learned that many patients suffer with fibroids for far too long before seeking treatment. And one of the key drivers of that is this altered perception of normal, this sense that, well, I use 20 pads a day or 20 tampons a day or 20 pads and 20 tampons a day, and that's normal, right? That's a normal period for me. That was a normal period for that seemed to be what my mom did, and that seemed to be what my sisters did, and it seemed to be what my aunts did, so that must be normal. And one of the things that we've learned, particularly amongst African American women, but amongst women of all backgrounds, is that we have to do a better job of educating ourselves on what is normal, so that women know that using 20 tampons a day actually isn't normal. It may be what you've done for years, it may be what your sisters did or your mom did, but it's actually not normal. That's bleeding that's too heavy, and that's likely causing you to become anemic. We also learned that women kind of adjust it to fibroids, and many women adjust it to fibroids or life with fibroids by settling. I remember very distinctly that one of the research subjects said, well, the fibroids didn't kill me, so I figured they would just make me stronger. While there may be some truth to that, we have to set a higher bar for ourselves as women than they didn't kill me, okay? We have to set a bar for ourselves that allows us to feel healthy, to feel strong, to feel empowered, to feel energized, and to know that we deserve to walk in that healthy space. And that if you're not able to walk in that healthy space because of fibroids, that you do have options, and that there is treatment available. But women first have to realize, as our two incredible patient advocates so well articulated, that you have to use your voice. You have to expect more for yourself and more of your health, and expect more of your clinicians as being partners with you on this journey. If your clinician is okay with you walking around anemic and tired and not feeling well, then that's a conversation you need to have to set a higher bar for you and to set a higher bar for that clinician as well. I think that what research does is it highlights and coalesces what many people are going through, and it raises the stories to a level of peer-reviewed literature, which folks around the world have access to and can read and say, I actually hadn't thought about this myself, but I can read about these experiences and change my care based on these women's experiences or these women's treatment response to this treatment. So I want to encourage you to consider research. I want you to understand why it's important, because it helps us provide, it helps inform your care, and it helps inform options that are available to you. I agree with the statements of the panel thus far that we need much more research. There's so many things about fibroids that we have yet to understand, but we are making strides every day. And with the support of organizations like the Society for Women's Health Research and our other our patient advocacy partners and our our health policy partners, as well as our government partners and our academic partners and our clinical partners, and most importantly, you, our patients, we will be able to get to a day where we can prevent fibroids. And if we can't do that, we can find a treatment that will prevent them from coming back. So looking forward to seeing that day along with you, and looking forward to continued, until we get to that day, looking forward to continued research so that we can answer the questions that we need, and so that we can offer and do what we need to do so that women get the best care possible. Thank you.
Thank you so much, Dr. Marsh. Tammy, I'll turn it over to you.
Good afternoon. I am Tammy Boyd, Chief Policy Officer and Counsel for the Black Women's Health Imperative. Thank you to SWHR for inviting me to be a part of this important conversation. I'm excited to be part of such an impressive group of panelists. So Black Women's Health Imperative, who are we? We are a national nonprofit organization dedicated to advancing health equity and social justice for Black women across the lifespan through policy, advocacy, research, and leadership development. Black Women's Health Imperative identifies the most pressing health issues that affect the nation's 22 million women and girls through evidence-based strategies. We have been working recently to elevate the awareness of uterine fibroids, particularly with elected officials. We work to pull together key stakeholders in uterine fibroids, such as SWHR, White Dress Project, Fibroids Foundation, AbbVie, providers, patient groups, and other advocacy organizations, again, to raise awareness and support the legislation that was introduced by Senator Kamala Harris and Congresswoman Yvette Clarke. The Uterine Fibroid Research and Education Act, how will the Uterine Fibroid Education Act help with fibroids? The legislation provides $30 million annually to the National Institutes of Health to expand research on uterine fibroids. It also will expand the Chronic Conditions Warehouse Centers for Medicare and Medicaid Services research database to include data on the services provided to women who experience uterine fibroid symptoms. It will also create a Centers for Disease Control and Prevention uterine fibroids public education program. And this is to raise and to spread the information around uterine fibroids. Also, finally, the legislation will direct HRSA in consultation with medical societies to develop and disseminate information regarding uterine fibroids to healthcare providers, including the elevated risk for women of color to develop uterine fibroids and the available treatment options. And so one of our strategies, again, we pulled together a group of key stakeholders But we look forward to talking about what's next in terms of, how do we really raise the awareness around uterine fibroids, particularly in increasing the amount of research that is done in on Capitol Hill. And we recommend that we do this through, meetings with members of Congress, Capitol Hill briefings. Now they have to be virtual, a social media engagement strategy. We also recently have been working with celebrities who also are patients who have experienced, who have uterine fibroids and can share their patient stories, similar to Tania and Tanika. And also, I want to really highlight that what we are trying to do, Black Men's Health Imperative, is really look through a lens of the everyday woman and the patient, and really take that story, the research that we spent the last 2 days talking about, and take that and translate that into policy and legislative action. And so look forward to the conversation today.
I'm going to start. Dr. Marsh, if you can hear us, there was a question that came in about clinical trials related to how can you find a clinical trial near you?
Unfortunately, there's not a good single, I would say, a patient-friendly source for finding clinical trials. One source that is available is clinicaltrials.gov, which is a website sponsored by the federal government that requires any group or company or team doing a clinical trial to register their trial, and will give you some basic information on what the trial is looking at, what's involved in the trial, how long, when the trial started, when it's anticipated to end, and we'll typically give a contact, and then you would follow up with that contact to get more detailed information. That's probably the most centralized way to find out about existing trials in your area. Many trials, particularly that are sponsored by large companies, will advertise about the trial locally. So if they're doing a trial in your city or in your state, they will promote that trial via television, via radio, via billboard. So that's another way you can keep out. If you're not expecting to see information about a trial on those venues, then I would say don't be surprised if you do. And then leveraging your patient advocacy organizations, like the two that are on this call. I think both Tania and Tanika, while absolutely patient advocates, are also plugged into, I think smart companies plug into them because they know that they are plugged into you. So I think they often know about trials that are going on or that are recruiting, and can give you information as well. So I know there's the short answer is that there's not a good way to access trials centrally for just fibroids, but those are some ways that you can access them and certainly get started.
Great, thank you so much. Okay, now I can see you all. I'm going to come back to hi everyone. Go back to a question about sort of normalizing the conversation. So Tania and Tanika, maybe starting with you all, how do you approach this conversation? And then Dr. Schubert, I would love for you to weigh in on sort of how to have this conversation with your provider.
Sure. I think access is key. Making fibroids education and information easily accessible to people, and that means in person and online. We started chapters so that we could really be a presence on the ground for women to be able to speak with you one-on-one, to really create a safe space. And I think Tanika has done a great job of this too, just for people to feel really at ease, to be able to share some very personal experiences, and to know that they're speaking with someone who has been through it already is key. And you might think that, you know, people have the ability to travel to this place or that place to learn the information and hear or pay a nominal fee, but that's not the case. Health disparities are real. And so we need to be able to provide programming to be able to access our community at large and be able to give them this information at no cost, to be able to make them feel like they can get what they need to make themselves whole. Because I think Dr. Marsh referenced body images and the emotional toll, and that is very real. And so there's a lot that kind of spins out of going through a fibroid health crisis. And so being able to let women know that they're not alone, like that messaging is key, goes a long way to help the patient heal and evolve beyond that situation. Tanika?
Yeah, I completely agree with that. If we aren't talking about it, as we both alluded to before, if we aren't sharing our stories, then nobody knows what we're going through. If we, you know, say that we're taking a PTO day because we have a headache instead of, you know, being on the bathroom floor in fetal position, bleeding for 21 days, then nobody knows. And as a patient, I do understand the discomfort a lot of times in sharing. But really, it is our gateway, and it is a resource to access the people who can help us and the people who we can help. So if you look at as being an advocate for yourself and also being an advocate for your community, it becomes a lot easier to eliminate the stigma, eliminate this being a taboo topic. And really, I think what's also important, and I think why our patient advocacy organizations are so important to this work, is because when you're going through this, you really, really, really have to find your tribe and your community. You have to find a peer who understands exactly what you're going through and won't dismiss it, right? We've already, in these past couple of days, talked about sometimes being dismissed by our physicians. Sometimes even our family members aren't willing to share their experiences, or also normalizing it again, saying, oh, everybody in the family has had fibroids. Every woman in the family has had fibroids. So finding our tribe, talking about these situations continuously and questioning everything. If you feel like you've bled too much in 2 hours, then say something about it, journal about it, ask friends about it, because it's when we begin to have these conversations that the stigma is eliminated.
And Katie, just add that we talk about a lot of uncomfortable things on the media, on, you know, there are commercials about erectile dysfunction. There, you know, the things that we that may not be part of social conversation. Almost all women bleed every month, you know, unless you're taking a medication to stop that. And so I think we as a societally have to just normalize those discussions and just say it's okay to talk about your period, and it's okay to talk about you know, it's okay to talk about your period being heavier. And we just we have to just start speaking that and speaking it to power, and speaking our truths and sharing our stories. And I say because, you know, we all wear a lot of different hats. We're clinicians, we're patients, we're advocates in one. And I think that we have to feel empowered and emboldened to kind of say it out loud. I think when you do say it out loud, you not only empower yourself, but you help people around you who may not be as strong as you, and it normalizes it for them, because we don't know who we're talking to who's also suffering in silence. And so just starting the conversation, just bringing up the topic can have an incredible domino effect. Like, oh, you've had that? Yeah, I've had that too for years. And somebody else walks into the conversation. Oh yeah, no, I've had it. And all of a sudden you're not alone. You're standing in a group of 5, of 10, of 20, of 50. And as Tanika said, you know, you have your tribe, your squad, your group who gets it. And I think the reality is that millions of women get it. You're not alone. Millions, tens of millions of women get fibroids, and we have to be able to talk about it.
Dr. Schubert.
Absolutely. Yeah. Yeah, I think, you know, from a clinician perspective, many times, you know, when we are going into practice, we really focus on the pathophysiology and what the disease is and how to treat it, because that's what we're really good at. What I've learned over the last few years is building that relationship, allowing for a safe space to be within the 4 walls of the exam room. Because just like Dr. Marsh was saying, you know, how we can massage out not just so much the clinical factors of it, because that's something that we can really tune into and help with that, but the quality of life factors that affect when you go out with your friends, your sex life, your dating life. There's so many different facets of how it can affect your life that sometimes we're unable to really assess because we're not asking those questions. And so for even putting that forward towards the patients is actually, sometimes that's a great way to let your healthcare provider physician know how much it impacts your life, because maybe that will help resonate that this is something that needs to be addressed. And then we can kind of work on it from a quality of life factor perspective. And I think that's sometimes a better way to start the conversation, because many times women come into the doctor's office and they're immediately afraid. They're like, oh my gosh, this is, I'm the only one who's going through this. Also that feeling that you're the only one who's going through that. And then there becomes this kind of like what we call the white coat syndrome. People actually come into the office with a bunch of questions, but when they're in the actual exam room and they're talking to the physician, it like literally disappears like magic, and they kind of forget all the things that they wanted to address. So maybe approaching it sometimes that might be helpful with patients and anyone who's listening today is to actually list the things in your life that it has affected. So that way we can turn that around into how is this clinical thing affecting your quality of life? And then we can approach it from that different perspective. Because let me tell you, the journey is so different for everyone. And that's how I felt I can meet the touch points for every different woman, is their journey and hearing their journey and how it affects them individually. And like Tanika and Tania said, you know, finding your group and finding who's really resonating with you from that perspective, but also making sure that you're taking the time to digest what your physician or your healthcare provider has told you. Because many times you may need to go back again to get that same information because it's new. It's new information that you're hearing, and sometimes you need to hear it again and again in order for you to digest it and then make a decision that's best for you.
Thank you so much. So Dr. Marsh, there's a question here. I wonder if we can maybe start with you. What are factors that contribute to the racial differences in uterine fibroids?
That's a great question, an important one, and one that we don't have great answers to, but I'll tell you some of what we know. We know that epidemiologically, meaning when we look at large groups of women who have fibroids versus those who don't have fibroids, and look at what features or what characteristics exist between the two groups, we find some interesting differences. And one is that women who have who start their periods earlier in life have a higher risk of fibroids. So what we call menarche, meaning the age at which you start having periods. And we know that Black women start having periods earlier, or Black girls, I should say, start having periods earlier than girls of other races. We know that obesity contributes to fibroids, or is associated with having fibroids, and that Black women have higher rates of obesity than some other groups of women, but specifically higher than white women. We also know that higher estrogen levels are associated with fibroid growth. And we published some work probably 10 years ago now showing that normally cycling, when we look at normally cycling African-American women versus normally cycling white women, even when we control for age and weight and obesity and things like that, that Black women have higher, excuse me, have higher estrogen levels on average, and particularly at certain points in their menstrual cycle. There's some molecular markers that seem to be associated with fibroids as well. But I think those are some of the larger things that may be contributing to a higher incidence of fibroids. I would also add that vitamin D, there's a suggestion, and I want to be clear, a suggestion that vitamin D may have a role in fibroid development. We don't know if it can prevent fibroids, if it has any impact on slowing fibroids. So I don't want everybody running out and taking 100,000 units of vitamin D, because we don't know yet. But the early data suggests that vitamin D may play a role in fibroid metabolism or fibroid pathophysiology, and that women with fibroids tend to have a lower vitamin D level than women without fibroids. So again, we don't know about causation, but there is that association there, and we know that Black people have lower vitamin D levels than many other groups because of the melanin in our skin and how we process vitamin D. So those, that's not a complete list, Katie, but those are, I would say, are some of the more significant epidemiological factors that have been, excuse me, suggested to contribute to why fibroids may be worse, if you will, in Black women versus other groups.
Great, thanks. So switching gears just for a second, Tammy, I want to direct this question to you. In 2005, the late Rep. Stephanie Tubbs Jones introduced legislation on uterine fibroids research. And so we know that bill has been around for a really long time. If you could just sort of talk a bit about, I know you mentioned the Kamala Harris bill and the Yvette Clarke bill, which is a continuation of that work from Congresswoman Tubbs Jones, but sort of what progress have we made? What can the advocacy community do? What is that conversation like right now?
Yes, so the late Congresswoman Stephanie Tubbs Jones, she was on the Ways and Means Committee, and she was definitely an advocate of the legislation. She introduced it in several Congress. And so the new, there's sort of a renewed interest in uterine fibroids with Congresswoman Yvette Clarke and Senator Harris. I mean, obviously Senator Harris is our VP pick. And so, regardless of what happens, she, depending on how the White House it happens, she, having someone in the White House that's an advocate of uterine fibroids could be great implications there. Separately, there have been several co-sponsors of the legislation, but in terms of there's been renewed conversation about it. And so looking to what we will do or what we should do, the next steps, continue to call your member of Congress and get them to co-sponsor legislation. But then also, as we begin to move into a new Congress, the legislation will have to be reintroduced. So every Congress, they have to reintroduce legislation. So although we have it, now we have to reintroduce it again. And so looking at an authorization track, also looking at an appropriation track. I saw in the question, someone mentioned the DOD as a way for funding. They mentioned they also fund endometriosis. And so yes, earlier we talked about over our 2 days with SWHR, we discussed different tracks, different ways, maybe linking it to a conversation around maternal mortality, maybe linking it to the conversation around some of the different funding streams that are for other diseases, such as other conditions such as endometriosis. But I would say, from this panel, I would definitely say the most powerful piece is definitely the patient stories. And For example, Centeria, with Abby, they visited several members of Congress offices. Tanika's from Georgia. She was very instrumental in getting one of the members of Congress from Georgia to actually introduce legislation. It was a resolution around raising awareness around Uterine Fibroids Month in July. And so just getting all those different champions, and when they hear the different patient stories, that definitely helps. Also, I mentioned engaging celebrities. Black Women's Health Imperative recently had Cynthia Bailey, as you may know, she's from the Atlanta Housewives. We had her on a webinar, talking about her story, but then utilizing those folks as well on Capitol Hill. But there's several, different ways, and another really important piece is definitely the key stakeholders. So it's not just one group. So it'd be your patient, you want your patient voices, you also want your providers, you also want advocacy organizations as well. So the coalition is what will be needed in order to actually move this legislation. Again, I think it's really sad that, Stephanie Tubbs Jones introduced this legislation so long ago, and we just have not had that much movement on it. And so really looking and developing strategies for action and increasing research around uterine fibroids is key.
Thank you. And I think to that point, both in the advocacy space, but also in engaging with friends or family members on this topic, Tanika and Sateria, do you have advice on how those who are on today might be able to reach out to people who are suffering in silence, and how can our audience help to spread the message on this?
I think there's many ways. One good way is to ask people what they need. Like if you go ask a friend or family member, what do you need? They'll tell you, or how can I help? Or share some information. I know that, there's always that need for support when you have that conversation. And sometimes it's easy to talk with women in your families. I think sometimes if you bridge that conversation, you'll find out more about the reproductive history within your individual family, and that can be enlightening, and it can really just forge a new level of your own relationship with your family members, to know that they've gone through maybe several generations back the same thing that you did as well.
I think to add to that, getting involved with patient advocacy organizations is key. The White Dress Project is a nonprofit organization. We do it out of the love of our heart and wanting to move this conversation forward. So helping organizations like ours that are really on a mission to be the patient voice and be patient advocates. So, we mentioned earlier, finding your tribe, finding your community. And as Dr. Marsh mentioned, the more you begin to converse about this, the more you see how many people and how many similarities there are. And oftentimes it helps you to solve your own fibroid issues, right? So I'm not saying that we should just talk to our girlfriends, go to Dr. Google, and then we figured it out. But once you use the expertise of your clinician, use the anecdotes of your community, know what you know about your body through journaling, watching what you're eating, all of these components together make for a perfect meal. And it serves to nourish everything that we're trying to do in this space. So like I said earlier, I think that sometimes it becomes difficult. We get disheartened by, a lot of the comments I saw, physicians aren't paying attention to us, legislators don't care, we have to add it on to something else. But we have to continue to share the story. You have to continue to get involved. You have to continue to find your tribe and make sure that the challenges that we are facing, that people know about them. And I know it sounds like an answer that is somewhat nebulous, right? Like how do we make these things tangible? But I promise you that we are making strides just by telling the patient stories. And as I said, connecting all of these tools and resources that we have, the clinicians, our families, and what we're doing, industry, the media, all of these things play into how we're going to elevate this conversation and get it done.
And if I could just add to Katie, I think that fear is a major barrier to treatment. And I think when you start to have conversations with other patients who have been through this, it removes that fear, or at least dissipates it to some extent, because the patient can share with you, or a patient advocacy organization, the pre-op information, what to bring with you to the hospital, what their experience was during the procedure, and post-op, how to care for yourself, which is really pivotal, because once you leave the hospital, having someone else to speak with who went through that procedure with the same procedure that you did can be a game changer in terms of just making everything easier, the overall process, and just making you calmer throughout the process.
Yeah, peer-to-peer advocacy is real, and it has, I'm sure Soteria would agree that it has also helped in her journey. It has definitely helped in mine. Just being able to have someone else that you can connect with is so important. I'm an only child, and my mother had fibroids, lost 2 sets of twins to fibroids, and I still said to myself, I don't have anybody to talk to, because you don't always feel comfortable sharing with your family, as someone mentioned earlier. So the peer-to-peer advocacy is key. I would agree with that.
Yeah, so we have a lot of questions about treatment options, fibroid journeys. I'll start with one that may get this started a little bit, and you actually just touched on this a little bit, Tanika, and it's something I've been thinking about too, as we've been engaging in this conversation. And the question is, are fibroids hereditary? If I had fibroids, will my daughter automatically be affected?
Was that one of the questions?
That's one of the questions.
That is a great question, because there's a very high genetic factor between fibroids and how that's generationally passed down from grandmother to mother to daughter. And so the most important part that I would take from that is, even though there's a very high genetic predisposition to having fibroids, if your previous ancestors have had them, is to not feel that because you have fibroids, you're automatically going to have an issue. So when we look at the distribution of fibroids and the incidence, up to 50% of women across all races will have a fibroid or fibroids by the time they're, say, age 50. And then if you take that now to African-American women and looking at that, what that incidence is, that's going to go significantly higher to your 75 to 80% that will have a fibroid. But just looking at that distribution, I mean, that sounds like an astronomical number and statistic. What we're really trying to focus on is to, one, make sure if you with fibroids that it does not become a scary issue, like something bad is going to happen to you. Because then, Soteria was talking about the fear aspect. So if that's where you're starting from a point of fear, then that sometimes can limit you to having discussions with your peers, but also getting the medical help that you need in order to navigate through that journey. But when we look at about 25 to 30% of that 80% that have fibroids, those are the ones that would have some symptoms that we probably need to address, and most commonly that will be with your heavy bleeding.
Great. And then I wonder if you all could weigh in, because we have several questions related to either folks who have had a hysterectomy as a matter of treatment 25 years ago or more recently, questions surrounding, are there non-surgical treatments for uterine fibroids? And I wonder if Dr. Marsh and Dr. Schubert could speak to sort of what is the current environment surrounding treatments and opportunities there. And then, of course, from Soteria, Tanika, and Tammy's perspective, what do you see as sort of areas of need here?
I will kind of get that started. We could have an hour-long discussion just on that, but I'll try to narrow it down. I think the short answer is that there certainly are more treatments available now than there have been in the past. There are not enough options. I think treatment options need to be driven by the patient goals, the patient's overall health, and fundamentally what the patient wants. you know, as long as there's not a concern that it's something dangerous. So there are key questions that help you go down the path of treatment options. You know, are you done childbearing, or do you want to maintain the ability to bear children? If independent of bearing children, do you want to keep your uterus? You may be done childbearing, but you want to keep your uterus. So that's, you know, that's another issue, excuse me. Are you a good surgical candidate? Are you someone that has a lot of other health issues and such that surgery is not perhaps the safest issue in you? Do you even need surgery? You know, could your symptoms be addressed with a conversation, quite honestly, and reassurance? Could your symptoms be addressed by a birth control pill or the vaginal ring? There are a lot of options. Again, are there enough given the prevalence of fibroids? No, they're not enough, but there are a lot of options that allow you to definitively treat fibroids, meaning different approaches to hysterectomy. Unfortunately, hysterectomy is the only definitive treatment we have for fibroids, meaning Dr. Schubert, Dr. Marsh, what treatment can you provide that assures I will never get another uterine fibroid? Unfortunately, hysterectomy is the only treatment that we have where we can say that. However, as we just discussed, you know, hysterectomy shouldn't be an option or isn't an option for many patients who either want to keep their uterus or want to be able to bear children. And so we discuss medical treatments, we discuss surgical treatments, we discuss radiological interventions, things like uterine fibroid embolization, or MRI guided focused ultrasound interventions. So there are a lot of categories of treatments that should be discussed with patients overall, but the ultimate counseling should be driven by the patient's goals, the patient's overall health, and ultimately what the patient would like to do, and putting the patient in a position to make an informed decision, a decision that she is able to make or that they are able to make based on getting the right information about all of their options, the risks and benefits of those respective treatments, and then moving, you know, and then feeling empowered to then make the right treatment decision.
And just to piggyback on what Dr. Marsh said, all of those options, I think, yes, we have moved away from where we have in the past when, you know, quite frankly, back in the time when hysterectomy really was the only option. So even now as a clinician, when I look at how many options that there are available, there are so many. The important part of all of these options is, one, when you talk to providers, that you're getting all of those options. Now, all of those options may not pertain to you as an individual and a patient because of things such as fertility or comorbidities, or if you're a good surgical candidate, or if you can't take certain medications. So that's where the medical advice comes into it and what would be good for you. But the important part is that you're having a robust conversation. And again, if you go in for consultation with a healthcare provider and you feel at the end maybe it was too much information, that can be sometimes overwhelming, to not feel that you should not go back and get more information. This is really how you take charge of your health and making sure that you get the key information, and also knowing that there are the future ramifications. So for example, if you're very early in the fibroid stages, how that can impact you later, if it's a fertility issue or if you plan on getting future surgeries. That really is how we're thinking when we're trying to counsel you, is what may come down the road. And so as you hear from other advocates, other patients, other people in your family, always take that information because it's very helpful. It really heightens the personal portion of this journey for you, but always remember that it may not pertain directly to you. And that's really why that conversation needs to be very equally yoked when you think of your provider and also your advocate in your group, in your tribe.
In terms of need, I think there are short-term goals and long-term goals. And I think that Dr. Schubert and Dr. Marsh really touched beautifully on the short-term goal, which is to be able to speak with a physician who is speaking with you the way that they are speaking with you today. Like, you should feel comfortable having a conversation with your healthcare provider. They should hear you. They should offer you options, even if they themselves don't perform that particular option. They should make them available to you in terms of educating you as it relates to your specific goals for treatment. And I think the other key need in the short term is accessibility. Women in rural communities, women in certain areas of the world who don't have access to care, who are hemorrhaging, hearing those stories really breaks my heart. And so I would love to see more treatments that are portable, where women can, if they can't resolve the fibroids altogether, at least eliminate symptoms that may have them being ostracized from their communities or unable to work. And then, ultimately the need is for women to have less invasive treatment options overall, and at some point, hopefully a resolution of fibroids altogether.
And just to add to that, I just want every patient on the call today to really identify with themselves being the CEO of their bodies, right? So you are in control, the ailments that you have, the pain you feel, the blood you're losing, and you really need to say that no one knows my body like I do. And then you need to employ medical health professionals as people who are working for you, right? I don't know if the doctors will agree with me with that, but that's the way I look at it. That my medical team are my personal board of directors for my health. And the moment I started to look at things that way, I started to recognize how much investment I needed to have in my health, just as much as I wanted my healthcare providers to have. Earlier on the call today, we were on a call earlier with some physicians today, and I'm not sure if it was you, Dr. Marsh, but someone mentioned that physicians have to do a better job of listening. And we really need to take this idea of individualized care to the next level, right? So really asking the patient, what's bothering them? How can we prioritize goals? What mental health and stress factors? But as patients, if we're asking doctors to do that, we also have to come to the doctor's office armed with questions, making sure that we're fully able to articulate what has been happening in our body. We can do that by journaling. So the way I look at this is that it is really a two-prong approach and a partnership, more than what Dr. Schubert talked about earlier, which is this white coat syndrome, where we often feel like we can't approach our doctors. I saw someone mention in the chat that, they just feel sometimes scared, or, doctors are always seen as this authority figure. But really, if I can impress upon you that you are the CEO of your body and your doctors serve as partners. So I would feel, and I would like to suggest that that is an unmet need. Of course, the access, of course, education, of course, lack of funding, policy, appropriations, all of those things. But really, we really need to speak more to the patient-physician relationship. And like Soteria alluded to, there are a lot of women who don't have access to a Dr. Schubert and a Dr. Marsh. And that's unfortunate.
Thank you so much for that. I think we have time for one more question. There are several questions in the Q&A about uterine fibroids and fertility, and I wonder if Dr. Schubert and Dr. Marsh, you might be able to briefly touch on that before we wrap up.
Yes. I think going back to when we were looking at the statistics of fibroids and how many women that actually impacts is, fertility obviously is a big part of, who we are as women. Whether you decide you want to have children or not, it still is a very big part of how we think of ourselves, and society sometimes can dictate that, which is not always the best way, but that's what we have to deal with. So when we think of fertility, I always like to preface it with, because you have fibroids, that does not mean that you're going to have an infertility issue. Because many women, again, bringing in that whole fear that we were speaking of earlier, as soon as they find out that they have it, it kind of freezes them to think, this now is another journey that I'm going to have to go through with fertility. So usually when we think of fibroids, I like to think of them as in size, location, and how many. And that a lot of time can dictate if you're going to have any issues. I think that it should be part of the conversation if you do have a diagnosis of fibroids, to make sure that is discussed, not in the sense that you have to have something done for it because you're going to have an issue, but also making sure that you know that ahead of time, so that as you're going through your journey, you can always let someone know, hey, I do have fibroids. This might be something that we may need to deal with later when we talk about from a fertility perspective. Now, if it does play a role in fertility, that again is why we have these conversations with our physicians to see, is it something that can be managed very minimally, like let's say a hysteroscopic approach, or does this need some significant surgery or major surgery where it will impact and there will have to be major surgery that's done? That again, when we think of the future, how that might impact the fertility journey, and then also when you do get pregnant, how that impacts the actual pregnancy. So there are many pillars to it, and that's why I always say these conversations may feel uncomfortable, but the point is, the more we discuss them, the less uncomfortable they become. And that's really where we would want to see this journey starting, is that you know what your diagnosis is, you're not bound by fear because of the diagnosis. And then as you go through your journey, figuring out where the input is needed and how you're going to navigate through that.
Great. Well, thank you so much. So we are up on time. I'm actually a minute over. I feel like we could probably talk about this for several more hours or days, given the questions and the conversation, but we really appreciate all of our panelists and the great questions from our audience. I again want to thank our sponsors, AbbVie, Myovant, and Roche for their support. Just to let you all know, because there were questions in the question and answer box about sort of where can we find out more information. We will be, we just finished up 2 days of fibroids events, and so we'll be publishing several pieces on these topics. So please follow us on social media, follow our panelists on social media. You can sign up for our newsletter, but we'll also share additional resources with you all. And we will also share the panel recording with attendees in the coming days. And please, again, feel free to contact us if you're interested in learning more. But really, thank you, Satiria, Tanika, Jessica, Erica, and Tammy, for giving your time and your expertise and for sharing your stories. And thank you to our audience for asking such thoughtful questions. So thank you again, all. Have a great day.
Thank you.
Thank you.